Okay, everyone, welcome back to the What Happens in Vegas podcast. I'm your host, Dr. Stephanie Canestraro, and today we have an amazing guest, Cathy Eason. She is the clinical director for Berkeley Life and nutritional. You have a background in massage as well, right? So we're
Yeah.
similar
Yeah,
because,
my first
Mhm.
profession was massage therapy and it morphed into nutritional therapy.
Yeah, so it's kind of similar for me because I'm a chiropractor by trade, right? So, and then it morphed into kind of the functional medicine from my own kind of health issues, right? So how did you end up going from the massage therapy into the nutritional therapy?
You know what it was is that I was working with a lot of orthopedic patients,
Hmm.
knee replacements and athletic injuries and things like that. And I started to recognize that my body work and exercise applications were only palliative. They weren't really contributing to reducing inflammation in the way I thought they should. And so I
Hmm.
started thinking, okay, there's got to be a different way
Hmm.
to approach this. And I started studying nutrition, and this was, we're going to say, 25 years ago. And I quickly realized that the information I was being presented didn't really resonate with me. And that's when I sought a functional nutritionist training program. And then I went on to teach that program for 15 years because I really
Wow.
believe in the power of functional medicine and functional nutrition. So it's that juxtaposition of structure and function, right, that
Hmm.
you know so well as a chiropractor,
Hmm.
and that fueling the physiology is important. And so that led me
Hmm.
back to food. And I'm fortunate to have been raised on a pretty whole food diet. So it wasn't a big stretch from my diet, but it made a big impact in the patients I was treating.
Yeah, we see that all the time now because I still have like a manual component to my practice and like working with some elite athletes. And, there's this contrast from when I worked with them just on their body to then in their off season, we really dialed in on, they finally like, wanted to dive deeper and we went into nutrition and even like clearing out some parasites and all that and then feeling their tissue the years after, seeing them perform better even though they're older, and
Yes.
their tissue feels better. So like that's going to make the lasting changes, like the stuff you do obviously on a daily basis and kind of, releasing those toxins from your body. But I know we're here to talk about nitric oxide because I mean, it really helped me, but since I just brought up the athletes, and how important it is for their cardiovascular health and just in general, let's start simple though. What is nitric oxide for people that don't know at all?
Yeah, that's the best place to start because even though it's been coined the miracle molecule and the longevity molecule, nobody knows what it is. And what it is a two atom molecule. It's a gas produced naturally in the body, but we can produce it in two pathways. We can produce it through an enzyme driven pathway that we're finding with recent research is more problematic for a lot of people, more problematic than they will maybe ever know because of gene variations and defects and a lack of nutrient cofactors. And then there's another pathway, which is what the Berkeley Life products follow. It's the dietary nitrate pathway, where we allow the body's digestive system and the microbes that help contribute to our digestive system. We let them use their enzymes to break down nitrates in our foods to smaller and smaller components to produce nitric oxide as needed in the system.
So what the problem with the first pathway, what is that? You said some SNPs, but don't we lose it as we age as well, this ability to make it with this pathway?
We do. There are three primary classes of enzymes that make nitric oxide. One is in your endothelial tissue called
Hmm.
eNOS, nitric
Hmm.
oxide synthase. One is inducible, say if you have an immune response like you experienced with your Lyme disease. And another is through neuronal nitric oxide synthase or nNOS. And each of those enzyme reactions requires a whole lot of cofactor nutrients for them to happen. And then, as I said, there's so much research now that there's some 27 known gene defects that can do what we call enzyme uncoupling, so that enzymes simply don't work like they're supposed to, and they reduce production of NO as a result. At the same time, in the endothelial tissue, which is where primarily we are producing NO in the body, that tissue degrades. The endothelial tissue lines every blood vessel in the body, every lymphatic vessel in the body, and it starts to degrade over time naturally, and then it's compromised further by our oxidative lifestyle.
Hmm.
So for your athletes, it might be the people who are over exercising and
Hmm.
not getting the recovery they need.
Almost
For the
all of them.
rest of us, I see you chuckle because I know you know those patients. Yeah, but it's the toxins in the environment and the toxins in our food and how poorly we detoxify those on a daily basis. It's lack of adequate oxygen that we take in because a lot of us with health issues have become inappropriate breathers. We don't breathe through our nostrils anymore. We breathe
Hmm.
through the mouth, and that degrades. And over time, that endothelial tissue starts to decline, and the production of nitric oxide from the endothelial tissue goes down as well. And it's
Hmm.
very problematic with aging
Hmm.
because the other things besides blood pressure regulation and opening blood flow and carrying oxygen and nutrients in the body that nitric oxide does is it also prevents platelet aggregation and it
Hmm.
prevents just plaquing in the bloodstream. So cardiovascular risk is high as we
Hmm.
age, and a big part of it is because we lose our NO production.
And then if you have those snips on top of it and you're an athlete or just anyone, then it's even harder. Is that the reason that it's more problematic for most people to use things like citrulline or arginine as a precursor for nitric oxide?
It is. There's a couple problems with that.
Hmm.
Arginine is an amino acid produced naturally in the body. Can through a balanced diet, we get all the amino acids we need, but what we're lacking are the cofactors. So we start throwing in these amino acids in a formula, and
Hmm.
what it does is it overdrives that system that is already lacking nutrition,
Hmm.
and it dumps the immediate precursors to making nitric oxide into the enzyme pathway, and nothing will work. And so now you're getting a buildup of amino acids. And there's a lot of evidence in the literature that that's actually really compromising to immune function,
Hmm.
especially in individuals who may have a low-lying viral load. It can
Hmm.
upregulate viral replication. And now you've got a worsening immune challenge and a worsening inflammatory response when you're trying to make more of the right stuff. So it
Yeah.
does become problematic.
Yeah, because that's what even all of the ones on the market that are like an SF for sport or for like the athletes, they all use like citrulline and arginine, and like I'm less comfortable with that, and just the results I've seen, with your product in general, because we were kind of talking before we started recording, and it was one of those things that like gave me relief that was almost immediate, or it was immediate, and like helped me get past my symptoms so that I could also work through getting pathogens out of my body, because how much it regulated not only my blood pressure and like heart palpitations that I was having, but also making me feel a bit calmer as well, which I guess goes along with lowering that. But, we were talking about that. So can you speak to that a little bit?
Yeah, and I'm so grateful that you found it and that you found the product and it helped you, kickstart that next plateau of healing because it is very foundational. I mentioned the two pathways. There's the enzyme-driven pathway and the dietary nitrate pathway. In the body, endogenously, when everything is working well, we would make about 80% of our nitric oxide through that enzyme-driven pathway. But again, there's so many people with enzyme uncoupling. And that uncoupling doesn't just happen because of enzyme defects, it also happens because of oxidative stressors that break down the enzyme function. In the dietary nitrate pathway, that pathway is there as a beautiful recycling system of the nitrates that we ingest on a daily basis, and unfortunately not in the quantities we need to. But it's a perfect complementary system to the enzyme pathway. And more recent literature, I focus a lot on autoimmune disorders right now in my practice. Recent research is showing us that compensatory capacity can really make up for a huge percentage of the NO that we need. So what you were feeling is the effects of not only the opening of the blood flow and the lowering of blood pressure. That is what Berkeley Life's gold standard clinical trial showed was a 10% reduction in blood pressure over 12 weeks of daily use and
Hmm.
improving circulation. It also
Hmm.
showed a reduction in inflammatory blood markers, things like
Hmm.
homocysteine, C-reactive protein, hemoglobin A1C. But the other things that you were actually feeling as a patient relate to all the multitude of other signaling mechanisms of nitric oxide. So it is working in concert with the vagus nerve to manage inflammation through the cholinergic anti-inflammatory pathway. It is working to stimulate an appropriate immune response, so to attract cytokines and chemokines that your body then uses to mitigate or modulate the response you're having. You mentioned that, you were feeling calmer. A lot of those elevations in things like the interleukins, interleukin 1, 6, 10, they can create what we call, sickness behaviors. And a lot anxiety is one of those sickness behaviors. So as soon as you start to calm down the immune response, the neurotransmitters that regulate our mood and give you enough dopamine and give you enough serotonin to bring down that anxiety, they start to work better. And nitric oxide plays a big role in signaling the nervous system as a neurotransmitter to regulate that function. It's signaling the immune system, it's signaling the cardiovascular system, the digestive system. There's really not a physiological system that nitric oxide doesn't play a role in.
I have a powerful story because it was someone that was just writing to me, not really working with me, and they're like, my sister-in-law, her blood pressure's through the roof, and they want to put her on all this, crazy medication. And I was like, in passing, just said, well, I use Berkeley Life and magnesium, like literally a body spray. And anyway, so they did extra body spray, magnesium, and Berkeley Life. Like that's it. No other lifestyle changes. And I get a message back from this girl, sister-in-law's blood pressure is completely normal. Like, so like
Yes.
magnesium can be one of the deficiencies, and so can these like nitrates. So that's just like a powerful story where it's like only like two things that this person took, and like they were about to be medicated pretty heavily. Like it was substantial high blood pressure.
Yeah, and that's such a great story to hear. And
Mhm.
as the clinical educator at Berkeley Life, I'm now getting to hear hundreds of stories all the time
Mhm.
from practitioners like yourself sharing those funny stories. I was using Berkeley Life clinically with my patients for about 6 years before I came to work for them. And I was really seeking a team, and I was seeking, just a different mode of using my skills and my talents. And I came to Berkeley Life, and then I started taking the product every single day for myself. And I am definitely in that over 40, over 50 category where my endothelial dysfunction is starting to ramp up just due to age. And within 3 days, I just thought, why have I not been taking this every single day? Because the biggest things people notice are improved energy, improved sleep, and improved mood. Those are the
Yeah.
three things they notice. And then the other things they notice are because there's better digestive function and there's better blood sugar regulation and there's better sleep, they start taking less and less supplements. And I've seen that in my own practice is that I can reduce the supplement burden, reduce the
Mhm.
stack by using Berkeley Life as a very foundational tool because of all the signaling that it does in the body. So I'm glad to hear you experience that as well.
Yeah, and the other question I had, because you guys have the salivary strips, and like a lot of the people that are using nitrates to build the nitric oxide, they use those salivary strips. Like, so can you explain? Because I know there's a portion of people who like sleep with their mouth open, so their mouth gets really dry. And I know there's a proponent of your oral microbiome that's also helping you create this nitric oxide. So can you just explain that kind of part for people?
Yeah, absolutely. Because it's all part of that, really, what I think is just one of the most beautiful physiological recycling processes we have in the body.
Hmm.
We consume dietary nitrates, whether it's spinach, arugula, kale, beets. It's very important to actually really chew those foods because they're
Hmm.
so dense in nutrition. And it also is required to break the nitrates away from the proteins that they're bound to in the food.
Okay.
So normally we would chew our nitrate food, we would swallow them. And we have, as we chew the food, we are bathing the oral microbes in the mouth. There's about 9 families of species of nitrate reducing bacteria in the oral cavity. And then within each family are a multitude of species. And what they do is they use their own nitrate reductase to break down nitrate to nitrite. And that's what our salivary test strips will test.
Hmm.
Let me explain the cycle and we'll come back to the test strip. So we chew our spinach salad. We
Hmm.
swallow our food. We've broken down some nitrates in the mouth. That is fueling the balance of the beneficial bacteria in the mouth and crowding out the more acid producing, gum disease producing, dental caries producing bacterial species. What we don't convert in the mouth gets swallowed. The
Hmm.
activity of your stomach acid and just the general acidity of the upper gastrointestinal system further breaks down nitrates to nitrites and pulls them into the bloodstream. And now
Hmm.
you've got nitrate and nitrite,
Hmm.
2 different compounds, in the bloodstream as the raw ingredients needed to make nitric oxide in the moment. Nitrates have a half-life of 8 hours, nitrite about 45 minutes, and nitric oxide is a gas. It's 2 to 3 milliseconds. So we need this oxidative reductive capacity and we need the right raw ingredients all the time to make nitric oxide. So we have the raw ingredients in our bloodstream. What we
Hmm.
don't use, which is a lot, about 60% of what we ingest gets excreted through the kidneys into the urine and out of the
Hmm.
body. We use about 15 to 20%. And what doesn't get utilized gets recycled to the salivary glands and stored specifically in the salivary glands. So then all day long, as we salivate, we are bathing those microbes in the oral cavity again, and it starts the entire recycling process all over again. We also have nitrate reducing bacterial species in the large intestine, in the community there. So we're really relying on that interplay of those. So what we use with the test strips is, and I've already taken my dose this morning, so we'll see. Probably about an hour ago. I'm in Oregon, so I'm in an earlier time. So it's kind
Oh,
of my
yeah.
habit to take my nitric oxide in the morning. So it's a simple test strip. You simply salivate it.
Oh, I was spitting on mine.
You can do that too. You can spit on it, pinch the ends together. And then what I should see, yeah, see, and I'm already low. It hasn't really been 90 minutes, so you can't really tell, but I should be bright pink on this strip, and I'm not. I did just come back from some oxidatively stressful time, meaning it was a wonderful vacation, but I was out in the sun, exercising, probably eating things I don't normally eat. It
Hmm.
also hasn't probably been long enough, but we use these to measure how much of that recycled nitrate is getting converted to nitrite in the mouth. And that's what the test strips are picking up. And
Hmm.
this has been clinically validated. It is a proxy marker of the amount of nitrate and nitrite you have in your bloodstream at any one time. So in about an hour from now, because I just took my dose, this should be super pink on the test strip. And that will be my expectation. It probably hasn't been long enough since I've taken it. But
Hmm.
these are fun, especially for your athletes.
Hmm.
Fun being they're a really functional tool that gives you kind of in the moment, like, what's my progress? When my patients and myself are recognizing that I'm low, it's going to entice me to do the other things I know build nitric oxide. So I'm going to do my nostril breathing exercises and
Hmm.
my 4-7-8 breath that, by the way, also tones the
The
vagus nerve,
Vegas
right?
nerve.
Yeah. And I'm going to be reminded to really chew a nice, healthy, leafy green salad at lunchtime. And I'm going to be reminded that, maybe I need to really think about what Dr. Stephanie told me about getting the toxic body products out of my life. So I find these a really nice compliance tool, and it
Hmm.
helps us measure the progress. So over time, when people take a daily dose of dietary nitrates in our
Hmm.
formula, over time, they will see, they'll wake up in the morning and they'll still show pink on the test strip because their body's gotten more efficient at
Hmm.
recycling the nitrates. And we did a 24-hour duration of effect study on our product and found that even just one capsule still kept people 10% above baseline 24 hours later. Two
Wow.
capsules, they were about 22% above baseline after 24 hours. And all of this is, of course, dependent on the bio individual,
Hmm.
what kind of immune challenges are going on right now, what's their current gut presentation, all of that. But, when we know that nitric oxide stimulates every system in the body, stimulates digestive function, blood sugar regulation, immune function, we're going to see these improvements happen relatively quickly because there's so much added signaling going on with something super foundational.
So that kind of answers my question because you said even 24 hours it keeps you above baseline. Because my next question was going to be like timing for my athletes around their games. I've been getting to them to do it like after naps. So say they nap like one to, or they're awake from their nap by one and they play, or sorry, at like four, I'm getting them to take it and they play usually at seven, but just so they can like, some people get nauseous from B vitamins or whatever it is, like just to
Yeah.
clear that area. But would you say that's a good timing for, taking it when you're doing it for performance for a game situation?
Yes, generally, but again, with those bio individual nuances of each person,
Mm-hmm.
because are they also, are they an athlete, but they're also burning the candle at all ends with the family and work. And so their
Yeah.
oxidative stressors are just high and maybe their sleep is low and all those things. But yeah, when we consider the fact that anytime we ingest food, it's usually a minimum of 90 minutes before that food passes through the
Mm-hmm.
digestive system. And so anything, if you're trying to hit peak performance, this is where the test strips would come in handy,
Mm-hmm.
is figuring out that athlete's pattern of
Mm-hmm.
restoration of nitrates. And so is it 90 minutes? Is it 2 to 3 hours? For myself, it's usually like I use an extra dose of the nitrates when I go take a hike. I live at elevation.
Mm-hmm.
And so I'm already a little oxygen compromised. And then I go hike up in the mountains and I use it for the mitochondrial boost because we
Mm-hmm.
know that nitric oxide helps stimulate the creation of new mitochondria and helps increase your energy production. I use mine about 90 minutes before I get on the trail kind of thing, or before I ski, or before I go to a hot yoga class, things like that.
Yeah, perfect. Yeah, so we could get them to monitor closely if they can mentally do that before the game. But for me, I found it was quicker and then I use it up faster. So do you
Yeah.
dose again if you see that happen?
Yeah,
Yeah.
I would. And
Hmm.
again, say you dosed in the morning, or not, you dosed before your activity. Yeah, you're burning it. Whenever you're presenting an oxidative challenge, and that's what's happening with exercise, it's not a
Hmm.
bad thing. It's just when it's excessive, right?
Hmm.
But you're utilizing the nitrates that you needed for that activity and for all the other functions in the body. So, as a recovery tool, we also know that nitric oxide contributes to the removal of lactate from the body. Really
Hmm.
important to, regenerating the cells and regenerating or, preventing pain and inflammation in the musculoskeletal system. So, I'd recommend maybe just dosing again, probably at your dinner
Hmm.
or at your whatever your post-event meal is, just to
Hmm.
sort of restore that capacity. So now you've got the substrate of nitrate and nitrite in your system
Hmm.
to keep your nervous system calm for your sleep, to, you
Hmm.
know, do that neurotransmitter function, to
Hmm.
regulate your blood pressure and
Hmm.
all the other things that it does.
Yeah, and I also have people using it like on the onset of a headache and having it act like that's what like our suggestions for a headache. Like some people go for like a Tylenol. We are like take some ginger and some
Yeah.
some nitric oxide builders. Do you
Yeah.
see that a lot as a
We do. And we have, in fact, if you haven't seen it, I'll send you the white paper on dietary nitrates and microvascular health because we see people using it for migraine,
Mhm,
for general headaches, tension headaches. We see people using it for neuropathy. And part of that is because, along with building healthy new mitochondria, nitric oxide stimulates angiogenesis, the formation of new healthy blood vessels that help open up the blood flow. And that's
mhm,
what's happening in headache is we're improving the blood flow, reducing the constriction, and getting the oxygen to the brain as needed and preventing that headache. The
mhm,
other thing I would recommend for your athletes is if we get back to that, the testing, let's say a patient tests and they're very low. They're barely register on this pink scale. They take a dose of 2 capsules
mhm,
of dietary nitrates and the cofactors. That's the NO foundation. And
uh-huh,
90 minutes later, we test again, and there's absolutely no change on the test strip. We suspect now that the oral microbiome is not balanced with nitrate reducing species. And so we have a prebiotic nitrate gum that is specifically designed to, within 1 to 2 weeks of use, replenish that balance in the oral
wow.
microbiome. Now, every dietary nitrate you consume, whether it's capsule form or food form, is
Mhm,
going to be better assimilated. But I use this with myself and with athlete patients as a boost, as
mhm,
a nitrate boost. And so I chew this on the way to the hike. I chew this on the way to a downhill ski day where I'm going to, really be shredding it up out there. I use this as an ergogenic aid, much like we used to use beetroot and things like that. We do have fermented beetroot in the primary product. It's not in the gum. But I really believe in the power of these nitrates, especially when we're restoring the oral microbiome. We're, relying on
mhm,
our digestive function. I believe in the body's ability to go, hey, there's that nutrient I was looking for. I'm going to break
mhm.
it down and use it right now. But I boost it with either an additional dose or with the prebiotic gum.
Amazing. I haven't tried the prebiotic gum yet, so I'm excited to try that out because I know you guys had it and I've been meaning to, but so many moving parts, but that'll be
Yeah.
something that I definitely use next. I have a question about so if you're using it on someone and most of the time we see it regulating people's blood pressure, like that's one of our things. But if it's not changing it and you're working on cleaning out toxic load, like everything seems to be going in the right direction, but that blood pressure staying, have you ever seen that? And do you think like if it's not the nitrates, is there something else that you've seen that helps that along?
That's where the vagus nerve toning comes in. That's really
Mm-hmm.
been my go-to is like,
Mm-hmm.
okay, let's get back to who's driving this immune response that's keeping blood pressure elevated. Because quite honestly, as soon as people start taking the nitric oxide support, I haven't seen anybody whose blood pressure did not budge at all. But
Mm-hmm.
historically, what I would do is I'd be focusing on those other
Mm-hmm.
vagus nerve activities, which are actually activities that contribute to nitric oxide production and they work
Mm-hmm.
in concert together. So it's the, meditation and nostril breathing and really, really well coordinated. I'm a believer in using the musculature. So I don't know about you, but what I recommend is as they do their nostril inhalation, let's say we're doing a 4-7-8 breath. They're breathing slowly through both nostrils for 4. We hold for 7. And then when they exhale,
Hmm.
the pursing of the lips is really important because the sphincter activation of the mouth muscles actually activates all the other sphincter muscles, including, say, the sphincter of the liver trying to release its toxic load. And so we want to activate all that. So I employ things like that. Maybe they need to see a professional and get a vagus nerve stimulation treatment.
Hmm.
I have a couple essential oil blends that
Hmm.
are energetically programmed to
Hmm.
tone the vagus nerve
Hmm.
that I use. And then other things. And then beyond that, when I think of hypertension, I think of those interleukins that I mentioned before in the immune system. What is still elevated? And this
Hmm.
might be a case where then a lab test is necessary to look for something a little bit deeper like that.
Yeah.
Or is there a missing toxin that, maybe you
Hmm.
just don't know that they're continuing to use a Glade plug-in thing in their
Hmm.
car and they're inhaling some chemical toxicant every day and it just didn't come up in conversation. And so maybe there's something else still driving that.
Yeah, that's a great insight. Or maybe they just need the gum because their mouth is not recycling it. So,
Yeah.
that's because that's the one thing that I haven't.
Yeah, I think that's where a more consistent use of the test strips to look for those individual patterns.
Yeah.
And
Yeah.
then if they're really not converting, we got to help them convert. And so
Convert.
that is where the gum comes in. The gum, beyond the dietary nitrates, the gum also contains a blend of specific polyols that are well studied in the dental world to feed the beneficial bacteria and, dysregulate the more pathogenic bacteria. Things like it. From a digestive health specialists, we are all trained not to use xylitol and sorbitol and maltitol. These are small quantities of these polyols that are really specifically studied for their benefit to the microbes. So we have to think of them as when you're chewing the gum, most of those polyols in the gum base are meant to feed those bacteria. We're not swallowing most of those tree alcohols. So I work with a lot of autoimmune and digestive disrupted patients.
Mm.
Nobody's had a problem digestively with the gum. But again, within 1 to 2 weeks, we've got their oral balance figured out. They're
Yeah.
testing better after they take their doses, and now all their symptom plateau just starts to
Yeah.
open up.
I feel like people, they take one thing and they make it like the enemy. Like, I don't think like, xylitol and all of these things, like, of course they have benefits to an extent, and you can go overdo anything, but there's amazing, research even on biofilm breaking and all of that with
Yeah.
with xylitol, and I've seen some changes. So I think, like, I never liked like the kind of dogmatic approach where this one thing's scary and this one thing's the best. Even like, this has beets in it. So some people are like oxalates, and I'm like, this amount of oxalates, like, can you speak to even how much oxalate is in the actual products?
I can. We got so many questions about that we did a clinical assay of the product to learn that in a 2 capsule dose, there are 0.7 milligrams of oxalates in a daily dose.
Hmm.
That is near zero. We do claim it because it's not zero, so we want to
Hmm.
claim it, but it is so minimal. Even people with a true oxalate sensitivity, say a genetic predisposition
Hmm.
to being sensitive to oxalates. The National Institutes of Health, the Linus Pauling Institute, they'll all tell you that you can have up to 150 milligrams of oxalates a day, even with a sensitivity.
Hmm.
Ours is minimal. So
Hmm.
it is, you're getting less than you would eating a leafy green salad. It's
Yeah.
really, yeah, not problematic.
Yeah, that's what I try and explain to people, but I think it's even better coming from you. And there's other leafy greens that you can get it from that are lower in oxalates, like arugula, right? But again, this is so low and it's such a beneficial product. And part of the benefit too is, like, that it has some other nutrients in it that help balance if there's any free radical formation or anything like that.
Absolutely, because nitric oxide in its gaseous form is both an oxidant and an antioxidant. It's going to
Hmm.
depend on the reactive need of the body at the time. And one of the concerns about nitrates is that they can, bind to proteins and become problematic, and especially binding to oxalates too, and contributing to kidney stones. But in our formula is enough vitamin C to act as an antioxidant at the same time. So you're providing the nitrates and the antioxidant. There is a methylated B1 and a methylated B12 to improve the digestive function and assimilation of the nitrates. And there's a little bit of magnesium to help relax the smooth muscles of the endothelial tissue and contribute to blood pressure
Mhm.
regulation and blood flow. So, very simple foundational formula. But yes, the cofactor nutrients are there for both assimilation and protection of the nitrates so that they do what they're intended to do.
And then is there some potassium in there as well?
There is potassium, it's in the potassium nitrate blend. Yes.
Okay, sorry. Yeah,
Uh-huh.
because
Yeah.
I feel like potassium was something that kept coming up low for me, and then that was part of like what kind of really helped me.
Yeah. Mineral balancing is interesting in
Hmm.
individuals because it's unique for all of us. And you had an immune challenge and you probably used, more of your stores than you thought. And
Hmm.
getting that balance back is a process.
Yeah, but it was immediate when I took it that like I said, I had that calming effect. My blood pressure regulated as well. So
Yeah.
funny, another thing that helped me was caffeine based thing that had some reishi mushroom in it. So just like,
Yeah.
they tell you to stay away from coffee. That was the only suggestion I got when I had actual Lyme carditis, like an infection. But
Hmm.
I was like, you know what? I'll just humor them and I'm going to cut out coffee and chocolate, which I wasn't having a lot of. And I did my blood pressure before and after because I was not happy not having my mushroom coffee, and then literally that helped me too. So those were the two things that I saw like a change in my actual blood pressure after using them.
Yeah.
And then I've taken now for years the Berkeley Life, and it's just like a staple now in my day to day.
It is a staple for me. When you see the science and you see the graphs that show that endothelial decline is about, 50% of the way there by age 40, and then
Hmm.
it continues to decline. And I think a really super important thing to bring up, especially for women in the 40 plus category, you're entering perimenopause, experiencing menopause, and postmenopause. And what we know about nitric oxide production is that it dramatically drops during those menopausal transition years because the synthase enzyme that makes nitric oxide relies on activated estrogen receptors. And as
Hmm.
estrogen declines, those enzymes don't work, they become uncoupled.
Hmm.
So, even more important to consume dietary nitrates to make up for what's being lost due to the loss of estrogen.
What if people like nitrates? I thought that's what was bad in my cold cuts.
Yeah, not all nitrates are the same, right? So our formula is, it's a blend of leafy green vegetables and fermented beetroot
Hmm.
and the cofactor nutrients I mentioned, that is not the same as the chemically synthetically produced nitrites typically that are being put into cured meats. It also has to do with the fact that you think about a salami, there's a huge protein component to it, and if there's not enough antioxidants to go with it. So think of your average charcuterie board. There's not a lot of green food on it, right? People are
Hmm.
eating the
Hmm.
cheese and the meat and the crackers.
Yeah.
And so there's a lot of risk for those nitrates in those cured meats to become oxidated. And
Hmm.
that's when they become problematic.
Perfect.
Always looking at labels, always looking for clean sources of nitrates. There's some for the people who enjoy those foods, there's some made with celery salt because celery is a rich source of nitrates. And
Hmm.
it really is the same thing. You're just getting in a different form. Do we recommend eating a charcuterie every single day? I don't as a nutritionist, but
Hmm.
yeah,
Yeah.
not all nitrates are the same. So, and then a lot of that myth has been busted too, because a lot of it has to do more with digestive function. Same
Hmm.
thing with the oxalates. I really see oxalate sensitivity starting, root cause is a digestive dysfunction for a lot of people. So, as you'll hear me say over and over again, chew your leafy greens. That's
Hmm.
how you get beyond that sensitivity
Hmm.
and make it less problematic and limit the other more inflammatory foods.
And then you also get that vagus nerve going when it
Then
knows
you
that you're
also get,
eating and like,
yes, uh-huh.
so, and then you talk about not using mouthwash, and that's because of, what we talked about before with the oral microbiome, because it's gonna,
Yeah. Yeah,
mhm,
it's the old Beauchamp terrain format where we used to think that everything needed to be antiseptic and cleaned out. We know a lot more about the trillions of bacterial cells that live on and in our body, and each, there's a different community in the oral cavity than there is in the gut. And so we do not recommend the use of antiseptic mouthwashes, antiseptic toothpaste. We want things that are not disruptive to that microbial balance. And there's a lot of great practitioners out there. We work with a lot of oral systemic health specialists, dentists, orthobionomists, myofunctional therapists, airway patches specialists, hygienists and stuff, they can point you to cleaner sources of mouth care products for sure.
Yeah, and then something else that, because of everything that I went through, everything started right with the release of G technology. So this EMF exposure. And I dove into that and, the changes in blood pressure from the release of too much calcium, the calcium dysfunction that happens. That's part of the reason that I found, and I'm using Berkeley almost like something to negate for people this EMF because of, the increase in blood pressure that can happen based on people who are EMF sensitive or maybe don't have strong enough membranes to like withstand, and I think it's too much for everyone, but we've seen major changes with people's symptomatology using this product with them.
Yeah, absolutely. And I'm glad to hear that. That gives me a nice area of research to dive into and see if we can find, more evidence-based results on that. It's hard to find that information, right? Because the technology has exceeded the science. I know in my own personal experience, we talked before the interview that as a mold toxicity sufferer and somebody who
Hmm.
was diagnosed with SIRS, I really had to pay attention to EMF exposure. And now, I just, anybody out there still sleeping with their phone by their bed, please get it out of the room and turn off your Wi-Fi routers at night because it
Hmm.
does. It brings a very inflammatory response. And then that's what nitric oxide, you build the capacity for the body to make nitric oxide in the moment as an antioxidant for the oxidative stress that's happening because of the EMF exposure.
Yeah, yeah. So it's been really cool to see, and it helped me personally with those symptoms as well. Like I had this almost like electric feeling. It was absolutely terrible, and it followed with like a lot of muscle twitching and like
Yeah.
really bothersome and troubling symptoms. Well, I know like we covered a lot, but one more thing I wanted to talk about was, just dietary, diet's so important, but I don't know about you, but I get these people that have pretty much perfect diets. They're eating better than anyone I've seen. They're having their leafy green salads, their protein, they're covering all the bases. They're still not like they still need this help, right? Like they still have high blood pressure or some problems. And then if you look at our actual soil, like is there a problem there like there is with magnesium, with like nitrate balance? Like what is going on there?
Yeah, I'm so glad you brought this up because it is not all nitrates are the same. As I said, between spinach and salami is a lot different. But
Hmm.
then spinach, arugula, kale, all those foods, they will have a unique nitrate content depending on the region of the continent that they're growing on,
Hmm.
whether it's a spring crop or a fall crop, whether it is there's research out there on what time of day they were harvested. So,
Mm.
and related to the moon cycle as well too. So some evidence that there are richer nitrate content in spinach grown in the fall and harvested in the evening dark
Hmm.
hours under a full moon. Really
Hmm.
kind of, it's like, wow, who thought to study all that? But point being, our foods, we can't really rely on the soil content anymore. Even the organic standards in the North American continent are varied. And so our recommendation is to eat as many. We have a great handout for patients on dietary nitrate rich foods, eating a balance of those, not just relying on one or two foods out of that group, but eating a broad spectrum of them. And then I do believe in buying organic produce. I really believe that's
Yeah.
important, and or growing your own, or finding somebody who does. So I think the key is to understand that we could send every bag of spinach that we buy off to get assayed and look for the nitrate content, or we could just eat more of those leafy green vegetables on a daily basis, get a wide variety, and then supplement. Boosting with nitric oxide support from Berkeley Life is the way to ensure that you
Hmm.
are getting the clinically proven 314 milligrams that are going to bring systolic blood pressure down 10% in
Hmm.
12 weeks. So
Hmm.
I think that's the key is we just don't know. I'm a nutritionist. I'm a little biased about what food does for the body, right? But
Yeah.
I still supplement because
Yeah.
of my own unique needs. And I think it's important to recognize that we do the best we can,
Hmm.
but we can't be too hard on ourselves that some of this is out of our control. So
Hmm.
my goal is to be grateful every time I eat a meal and take it in with loving, kind intention for my body,
Hmm.
and then I supplement with Berkeley Life and a probiotic. That's about all I use in my daily routine right now because I have found my balance that way.
No, that's amazing. And I think like some once people can clean out, their toxic load, diets. I'm just saying there's those people where you're like their diet is amazing. I'd say 10 out of
Yeah.
10 like and they're still having major problems because there's those, molds like you said that they're exposed to that isn't getting taken. So we're always uncovering those things that we have to get out of the body, heavy metal load, whatever it is,
Yeah.
Lyme or other stealth infections that people realize they don't have, like parasites, things like that. And, just giving the body like that purge and then everything seems to rebalance and then they need less and less, kind of like where you are right now. I went from, gosh, 50 something supplements a day to very few now. So
Mhm.
that's great as well. So just time and place for when we're using things and but food is very, very important. I'm with you on that.
I've been where you were. I think I'm on year 8 of my recovery.
Hmm.
And about the first 5 years, I was utilizing everything. And one day, when a physician I was working with to support me recommended a protocol that just didn't really inherently feel like something I wanted to do, I sort of had enough and I stopped everything. And I
Hmm.
declared it was July,
Hmm.
and I declared 31 days of Thunderful, and I made sure that I had fun every single day in July of that year. And
Yeah.
after that 31 days, and I did other self-care things with diet and
Hmm.
exercise and saunas and all the other kind of detoxifying things I was still doing.
Hmm.
After that 31 days, I re-entrenched myself in my healing with a much smaller load, and that's when my true healing happened. So I clearly had something, I had some kind of attachment to that illness that I
Yeah.
hadn't let go of yet.
Yeah. For me, it was 10 years ago that I first got this crazy, tentative diagnosis of MS, which now I know is Lyme neuroborreliosis that returned on in 2021 based on
Yeah.
load. But it was like, and like a very stressful time during COVID and everyone's gone crazy and you're like so there's that obviously that stress point. So you're having fun every day is the best prescription you can give someone, for sure. But
I was still working at that time, but I just
yeah,
made every workday more fun
yeah, no,
and I
that
expressed it too. I did a lot of verbalization of and affirmation of I am well, I am healthy,
hmm
doing
hmm
some kind of dynamic neural retraining in there. And I
yeah,
was working on toning my vagus nerve. I was doing
yeah.
that a lot.
Yeah. I mean, the funny thing is, and I say that to people, like I was doing those things when this returned on for me. It's like a week before I had said I feel the most vital I have in years, and like I was jumping on the trampoline and having fun with my nieces and nephews, I remember. And it was like that. Like, I knew it was an external, like environmental thing that also interacted with my body, like something that was left. And it ended up, I had this huge heavy metal load left over. So, like, because, like, I was there with that and like having fun and toning Vegas, or even though there was stressful things going on. So sometimes like, I had trouble with the point that this is something I did to myself because I'm holding on to this or holding on to that. And a lot of people are like, oh, it's trauma, it's this. Like, everyone has their thing. But I'm like, but
Yeah.
sometimes what if it's just that something, it was those external factors turned on with something in your physiology, even though you weren't attached to, you don't want to be sick and you don't want this, right? So
Right.
like,
Yeah.
I just like want to clarify that for myself at that point in time when this turned on again. It was like such a good point in my life and I was enjoying
Yeah.
that feeling healthy and all of that, and it felt like it was like really taken away kind of quickly. So
I have seen that in other
yeah.
patients, similar scenarios, and they're feeling great. They're feeling healthier than they have in years. They take their dream vacation,
Hmm.
and then a few months later, we discover there's a parasite that they picked up simply by drinking the
Yeah.
water in
Hmm.
a foreign environment to them. And it
Hmm.
was just an exposure
Hmm.
because we have to keep in mind the body has memory and it has
Hmm.
memory of how to function well and how
Hmm.
to,
Shut down or
dysregulate and
something.
how to shut
Yeah.
down.
And That's what it feels like happened. So it was just so shocking to me, like, and it was a very humbling too, because I was doing the things and it made me have to dig a little deeper, but like, and it turned on in such a way and it was so aggressive
Yeah.
that like, it was like a different entity, like altogether, like it was evil almost, like, and it wasn't easy to shut off either. So yeah, like, I mean, that's a whole other thing, but
Yeah.
I mean, a lot of the time people do have that, but I'll say truly for myself is that I was thriving being a functional human. Like I had no
Yeah.
reason to want to go into like a sickness like behavior. So, anyways, side note, but I know there were still things underneath and there's even there can be generational trauma. There's all of these different things, but
Yeah.
sometimes I think it's just this bad interaction and then you have to dig even deeper. But anyways, that's a whole other thing. This
That's a whole nother topic.
That's a whole other thing, but this has been amazing. I mean, we've learned so much about nitric oxide in general, how it's made, like, and we have this powerful tool with this amazing study and anecdotes, even from practitioners, which to me sometimes are the most powerful things,
I
right?
think so too.
Right? Because how many anecdotes do you have to have before that's considered like a study?
Evidence-based. Yeah.
Evidence. I mean,
Right.
I don't know. So, yes, thank you so much for your time and knowledge on this topic. We love your product and we sell it and we will are, educating people on it. We're going to start trying the gum and some of the other products and use the test strips even more than we already are. So, yeah, thanks so much for being here. Is there anything else you want to add?
I think I would just add, thank you. It's been a pleasure to be here. We are
Hmm.
happy to support you and your practice and your patients. And anybody listening to this is available to use your unique Berkeley Life code to order. And it will give you the show notes to have a discount where I think it's Dr. Steph 15. They can get a 15% off
Hmm.
discount. That'll all be in your show notes. And I think just I would encourage, there's lots of ways to improve your nitric oxide on a
Hmm.
daily basis. So whether or not you take Berkeley Life, which we hope you do because of its amazing impacts, sleep, deep
Hmm.
breathing, gratitude, and clean food are always the way to go. So that's
Amazing.
just my closing points for you. All
Amazing. I love those. That's so powerful. Thanks again so much for being here.
right, thank you.